All right, the Food and Drug Administration wants to get tough on tanning beds. The agency recently proposed some new rules to warn people about their link to skin cancer. But there's definitely some backlash from the tanning industry. And joining us today to talk about that is CBS 47's medical expert, Dr. Dabe. So what are they proposing, Doctor?
Well, the tanning bed industry is opposing these changes, and the medical groups are recommending tighter rules. What the FDA is proposing is to reclassify tanning beds from low-risk medical devices to moderate-risk devices, and requiring warning labels requiring young people against their use. And this is important because I've seen a rise in skin cancers, including melanoma, a deadly form of skin cancer in young women who are the most common users of tanning beds, Mike and Jenny.
Yeah, so speaking of that, is that the main risk with these beds, and what else does it lead to?
In addition to skin cancer, there's a greater risk of skin damage, including premature aging, skin burns, as well as eye damage, and for some people, this can be addictive.
And I'm guessing certain people are more at risk than others?
Everyone who uses tanning beds is at risk, but young people, especially people under the age of 35, are at greater risk, and people with fair skin, and the risk is greater in people who use it more frequently and with greater exposure.
I've seen some salons now that have signs of doctors kind of endorsing it. So what exactly is the debate going on about these beds and what the restrictions are with them?
Well, some people are saying that there should be fewer restrictions and that there might be health benefits to tanning bed use or indoor tanning, but the research does not support this, and we know that there's a 75% increased risk of developing melanomas, and this risk may be even greater in younger indoor tanners.
So you get the vitamin D from it, but that doesn't really outweigh the risk, you're saying, of the chance of cancer.
Exactly, Jenny. In people who live in colder climates where they may not get enough sun exposure, they can get their vitamin D needs met by oral supplements, such as vitamins, rather than exposing themselves to this risk of skin cancer and skin aging. And the dangers are so great that myself and other medical groups are recommending banning tanning beds, at least in minors, as the state of California has done.
All right. Thank you, Doctor.
You're welcome.
Appreciate it. Dr. Dabe joins us every Tuesday on The Noon Show. If you have a question or a topic idea for her, you can email it to us at newsdesk@cbs47.tv. And we'll be right back.